You're watching Medical News Network, your trusted source for the latest in medical news and information. I'm Mike Wittgenstein. Today's show is on smile makeovers. We're fortunate to have in studio one of Arizona's top cosmetic dentists. So if you're unhappy with your smile, self-conscious about your look, or would just like to improve yourself, this is for you. Stick around, we'll be right back.
Welcome to an educational and comprehensive discussion with one of today's medical experts. Your trusted source for the latest in medical news and information. You're watching Medical News Network.
In studio today, we have Dr. Paul Gebhart. Dr. Gebhart graduated from Northwestern University Dental School, where he was asked, because of his exceptional talents, to stay and join the faculty. Eventually moving on to open several advanced dental facilities where he is making over smiles and changing lives. Dr. Gebhart, welcome to the show.
Thank you very much, Mike. I appreciate it.
Before we get into today's topic about veneers, tell me a little bit about yourself.
Well, Mike, I grew up in the Midwest, went to dental school in Chicago, where I taught in the faculty at Northwestern for a little while, and then I moved on to open up several different dental offices in the Midwest. Got tired of shoveling snow every year and decided to move out here to Arizona and set up a wonderful dental office.
Let's start with what's new in veneers. Last 15, 20 years, what advancements have been made?
Oh my goodness, there's been so many different advancements. We've got better materials, better bonding agents to bond the veneers to the teeth, much better laboratories able to make things that look so realistic you wouldn't know that they were veneers.
What are some of the common misconceptions about veneers?
One of the major misconceptions is they're not for everybody. You know, everybody can afford veneers. They're not nearly as expensive as everybody might think that they are. We can change so many things in somebody's life with porcelain veneers.
Now, I know that you mentioned to me prior that you've actually had veneers put in. I mean, I would never know it looking at you.
Yeah, when I was, probably about 12, 13 years ago, I had one of my instructors when I was in dental school actually made a wonderful change in my life by offering to do some porcelain veneers for me. And I had grown up all my life. I had orthodontics, braces to straighten some of my teeth, but the shape of my teeth just wasn't right. The coloration of my teeth was splotchy and brown and white spots. I just was never happy with them. And then when she offered to do this for me, it really made a huge difference in my life.
So you had them done 10 or 12 years ago. How long do they normally last?
Well, I would say if you take good care of them, they'll last plenty of times past 20 years. Mine were done 12, 13 years ago with materials and equipment and laboratory technique that is 12, 13 years old. Right. Since that time, the bonding agents have gotten much better. The porcelain that we're using is so much better.
Now, does everybody use basically the same bonding agents and the same porcelain? Does all the dentists do it about the same?
Oh, no, definitely not. There's still the same bonding agents out there that were used on my teeth 12 years ago that are still being manufactured and used by dentists all over the country. If you don't stay on the cutting edge of the materials and techniques, you're gonna limit yourself to what you can do as a dentist. We use the top of the materials, the newest porcelains, the newest bonding agents. It makes a big difference.
What can you fix with veneers? Can you fix the gap between the teeth? Can you fix a missing tooth? What all can be?
Well, you can't fix a missing tooth with veneers, but in between the teeth spacing, what we call a diastema. A lot of people have that where in between the front two teeth there's a gap. That's very easy to fix with veneers.
What about if you have the teeth that are like too small or too big? Can you adjust that?
Oh yeah, some people have the front of their teeth, the edge don't line up. The one edge might be lower than the other. You might have a little chip in one of them. A lot of people have some discolorations in their teeth where some areas are darker than others. You can fix all that with veneers.
Now, what about people that say they fall out?
Oh, I've never had a veneer fall out ever. Any of my veneers that I've ever done have never fallen out. The bonding technique is so strong, it's actually stronger than the tooth itself. The bond of the veneer to the tooth is stronger than the tooth.
Okay, what about I don't notice on you, but I see a lot of people have that little gray line. You've seen that around the edge of the tooth?
Yeah.
What causes that? That's
usually from a crown that has a metal substructure underneath of it.
What is the difference between a crown and a veneer?
A crown fits around the entire tooth. It goes from the front of the tooth around both sides and around the entire back, all the way up to the gum line. Now, with the metal fitting crowns where you have a metal substructure underneath there, you don't get any light transmittal through that crown. Any light that comes in and out of your mouth doesn't transmit through the crown. That's why you get that dark line at the top of your tooth, because the root is actually shaded because there's no light transmitting through the tooth. Your gums will get a little bit discolored around the tooth like that where there's no light transmittal. The gums will look a little darker around a tooth that has a metal crown. Some teeth have to have crowns, and other teeth can be cosmetically altered with veneers. If you have a lot of decay in a tooth, or if it's been broken too badly to be fixed with a veneer, then we can use an all ceramic crown, something similar to the material that we use in a veneer, but it goes around the tooth to restore the structure of the tooth a little bit more.
You said just a moment ago that you can actually change somebody's bite. Can you fix it? So if they have trouble chewing or biting, can you fix veneers so that their bite's straight and nice?
Oh, definitely. I've done cases where somebody was looking at having orthodontics done. They didn't want to wear braces for 2 years or go through any other orthodontic process. They wanted something a little bit more immediate. And
how long does it take, by the way, if I decide I want to get veneers?
If you wanted to get veneers, it would take about a 2-week period of time. From one appointment, we prepare the veneers, you leave with temporaries that look just like your permanent veneers are going to look. And then afterwards, you come back about 2 weeks later, we bond the veneers onto your teeth, and you're done. And
what about so when I leave, I still have teeth?
Oh yeah, definitely. Back when I was in dental school and I had my veneers, I had to go around without any temporaries at all.
Do you think there's still dentists that do it that way?
I would imagine so, because the technique making the temporaries is somewhat sensitive as far as, it takes a lot of practice. You have to do a lot of them to get good at making the temporaries.
Is there a learning curve?
Oh, definitely.
Are you better now than you were 12 years ago?
If I was doing the same thing that I was doing 10 years ago, I wouldn't be able to sleep at night.
Really? Is that big a difference?
It is a big difference.
So if somebody decides they want to get veneers, and they go, what should they basically look for in somebody that's going to do them for them? I mean, can all dentists do veneers? Do you have to have a special license?
No, it's general dentistry.
It's not a recognized specialty, is it?
No, cosmetic dentistry, it should be a recognized specialty, but it's not. There's a big learning curve. There's a lot of dentists out there that aren't doing the technique correctly.
Have you ever had to fix anybody's?
Oh, plenty of times. I've had patients that have come in, they just weren't happy with the quality of their veneers. I look at the lab work that was done, and you can tell that they weren't using a good lab. The veneers are very opaque. They don't have any translucency to them. Does the lab
make a big difference?
Oh, definitely. You have to use a good lab. There's plenty of labs out there that have cut rate prices. You don't want to go to a dentist that's using a lab like that. You want to get to somebody that's using a very good lab that has the ability to, I use a local lab here in Phoenix that we're able to send the case and the patient directly to the laboratory for customized shading.
How do you decide what shade? Because I see people that they smile, and I don't know if they're really good at brushing their teeth or they just have somebody just put in the whitest veneers I've ever seen, and it almost, to me, it looks fake. I mean, can you see a bad veneer job?
Oh,
do you have an eye for it?
Oh, I have such an eye that when somebody comes in with a tooth, I might say, that crown or that veneer really just doesn't match the rest of your teeth, and they might think, oh, it looks fine to me. When I can change that and make a new one that actually matches their smile, they're amazed. They were walking around with that tooth in there that never matched. They didn't notice it, but when you put something in there that is correct and works with the rest of their smile, it makes a big change in their lives.
Right, we have to take a break. I know you brought pictures. I want to see them, the before and afters. And I want to get into some more particulars exactly about what happens when you have veneers put on. Okay. You're watching Medical News Network. I'm Mike Wiggenstein. We'll be right back.